Guys, so today's topic is headache, which is the chapter number 45 of John Murtagh. So we are going to follow our diagnostic model, starting with probable diagnosis. If a patient is coming to you with acute means short onset of headache, and he also has some symptoms of flu and respiratory tract, then we can say it is likely due to respiratory illness and respiratory infection, and it is the most common cause of headache. Then comes the chronic headache. If a patient is coming to you with chronic headache, it can be due to tension type of headache, combination migraine, and chronic migraine, which is the transformed one. So, what are the serious disorders which we should keep in mind and which should not be missed? These include in cerebrovascular, we have subarachnoid hemorrhage, stroke, transient ischemic attack, intracranial hemorrhage, carotid and vertebral artery dissection, temporal arteritis, cerebral venous thrombosis. In cancers, the headache can be due to space occupying lesions like cerebral and pituitary tumors. If the patient has associated fever, it can be due to infections like meningitis, encephalitis, and abscess, hematoma, subdural or extradural hematoma, um, pressor responses, for example, in the patients of pheochromocytoma, and glaucoma. If a patient has eye complaints and headache, we can suspect glaucoma and benign intracranial hypertension. These are some of the serious disorders which should not be missed, or otherwise, it can lead to mortality. Then we have the pitfalls, the disorders which often get misdiagnosed and ignored. These include cervical spondylosis and reversible vasoconstriction, dental problems like toothache, reflective errors, sinusitis, ophthalmic herpes zoster before eruption, patient complains of headache, hypoglycemia, and especially in patients of diabetes who are on antidiabetics, and they have not eaten anything in a while, so they can complain of hypoglycemia. They can complain of headache, and the underlying cause can be hypoglycemia. Then post spinal procedures like lumbar puncture or epidural injection. Then post traumatic and sleep apnea. Sleep apnea can also result in headache. In the list of seven masquerades, we have the patient can complain of headache and depression. Diabetes can also be one of the causes. Drugs like alcohol and continuous usage of analgesics can cause rebound headache, anemia, thyroid disorders, and spinal disorders. In drugs, COCP is also one of the causes of headache. Patient is trying to tell me something. If a patient, by judging the emotional and behavioral properties of a patient, we can suspect as the patient have a psychogenic headache, as a psychogenic illness due to which he is experiencing headache. The thing which can point towards the psychogenic headache is that the patient complains of the headache to be every minute of the day for days and months. It is not relieving with anything. By looking at the timeline, we can go for certain diagnosis. For example, if a patient has acute onset of headache, which is very severe, it can point towards a subarachnoid hemorrhage. It can be exertional headache, like after exercise and intercourse, migraine attack, cluster headache, reversible vasoconstriction. If the patient is complaining of subacute onset of headache like recent and it is an increasing pattern, it can be due to expanding intracranial lesion like space occupying lesions, and temporal arteritis can also be the cause. If the headache is presenting with recurrent episodes, the diagnosis can be differential diagnosis can be migraine, cluster headaches, and neuralgia. If a headache is chronic, it can be tension headache, rebound, or chronic migraine, which fails to respond to drugs. If you are on drugs for a long term, or analgesics for a long term for headache, the headache does not respond to analgesic anymore, and the headache is termed as rebound, and chronic migraine can also be there. Then we have cervical, due to cervical spine problems, the headache can also be cervical spondylitis and cervicogenic can be the cause of headache. If a patient is complaining of headache, which is on waking up, if the headache is severe, it can be vascular headache like migraine, cervicogenic headache due to the most of the times due to a big pillow, the patient complains of cervicogenic headache, a space occupying lesion, and hypertension. These are some of the headaches which the patient complains upon waking up. Which are the what are the red flags which we should not miss if a patient is complaining of headache? The patient has sudden onset, and especially if the patient has no previous history. Severe and debilitating progressive, the headache is progressive and it is associated with fever, vomiting, and seizure. Patient has confusion and delirium, and he is not aware of his surroundings, time, place, and person. Personality changes are there. The headache is worsening with posture, cough, and sneezing. The headache is maximum in morning, and headache is so severe that the patient has to wake up at night due to pain. The patient has neurological and any visual symptoms like blurring of vision and episodes of blurring of vision. Patient is young, obese female with decreasing vision. We can suspect benign intracranial hypertension. If the headache is a very new presentation in elderly patient, especially of more than 50 years, and he has a recent onset, post head injury, because the patient can have subdural or epidural hematoma, and the non-migraine attack in pregnancy and postpartum women because we can suspect of eclampsia and preeclampsia. On physical examination, what are the red flags which we can see is that of altered level of consciousness, signs of meningism, like neck stiffness, clinic signs, and Brzezinski sign, abnormal vital signs like blood pressure, respiratory rate, and temperature, pulse rate. These are not stable. Focal neurological signs, for example, if a patient has weakness or paralysis of limb. These are the focal neurological signs. Tender and poorly pulsatile temporal artery. It can point towards temporal arteritis. Papilledema on fundoscopy. It is due to a raised intracranial pressure. So on age-wise, in age-wise, headache can be, what are the causes of headache in children? Most of the times it is respiratory and febrile illnesses, most commonly in children. Hair traction or eye strain due to refractive errors, and hypoglycemia can also be a very common cause of headache in children. Pointers towards serious headache in children. If the headache is persistent or recurrent, it is the first thing in the morning, and the child is waking up at night due to headache. There is no past history of headache, and there is no family history. The child also has associated poor health. There are associated neurological symptoms and neurological localization. Headache in elderly, SOL, space occupying lesion, transient ischemic attack, trigeminal neuralgia, vertebrobasilar insufficiency, cervical spondylitis, temporal arteritis, glaucoma, subdural hematomas. If a patient has a history of frequent falls, so patient can develop subdural hematoma, chronic subdural hematoma, and acute subdural hematoma can also be there. And elderly are prone to subdural hematoma. These are common in elderly patients. Coming towards individual type of headaches, first we have tension type of headache. It is a very common headache. It is usually associated with tension and stress, and it is a symmetrical tightness all over the head, and it is also associated with cervical dysfunction, and it is symmetrical and bilateral. On the other hand, we have migraine. Migraine is the classical presentation of migraine is it is present. It presents with unilateral localization. Half of the head is affected. What can be the types of vascular headaches? Vascular headaches are the ones which are due to the vasodilation of arteries and vessels in the brain, and it which causes headache. Migraine is one of them. What can be the types of migraines? We have common migraine, which is normally without aura. The classic migraine, which is headache, vomiting, and plus aura. The complicated migraine, a patient has only aura without migraine. It is also called as acephalgic migraine. Cluster headache, menstrual headache, chronic hemicrania, paroxysmal hemicrania, and exertional headache. These are the causes of vascular headaches, types of vascular headaches. Then we have, what are the features of migraine? Migraine is usually 1 to 2 times per month, and it usually lasts for 72 hours. It usually lasts from 4 to 72 hours. It do not last for many days. And the migraine attacks are paroxysmal. The patient also wakes up from sleep. And the triggering factors can be stress and tension, caffeine, chocolate, COCPs, and the patient gets relief from migraine when he sleeps and has vomiting. The patient has also as other associated symptoms like nausea, vomiting, visual hallucination like scotoma, and sensory hallucination can also be there like paresthesia. So, what are the cluster headache? Cluster headache is also called as migraneous neuralgia. It is cluster is the name because the headache presents in cluster form. Like it has a cyclical nature of attacks and at least five attacks a day. And suddenly it presents usually suddenly during the night. And the pain is associated with retroorbital pain, rhinorrhea, lacrimation, and episodes come in clusters, each episode lasting from 15 to 180 minutes and on average 30 minutes. And it is aggravated with alcohol, cluster headache, while my cluster headache is aggravated on with alcohol. Then we have cervicogenic headache. Cervicogenic headaches are the ones which are the headaches which are due to the disorders of neck. The headache is usually occipital the headache is usually present in occipital region, and it radiates to the parietal region up to the neck. It usually presents on waking up, and the neck stiffness is also there on examination. C1, C2, and C3 would be tender on palpation, and there would be stiff neck muscles. What is the combination headache? Combination headache is actually the combination of tension headache, cervicogenic causes, and migraine attack and rebound attacks. It is usually due to stress or something. Sometimes follows an accident. Temporal arthritis. Temporal arthritis is related to the polymyalgia rheumatica. Most of the times, it presents in the age of more than 50 years of age, and it can temporal arthritis needs to be treated because it can affect optic artery, which can cause blindness. Patient complains of constant worsening headache, which is associated with malaise, weight loss, and the patient is also complaining of decreased vision, blurring of the vision. So we can suspect temporal arthritis on labs. The ESR would be markedly raised. Raised ICP. What are the features of raised ICP? Can be due to space occupying lesions like tumors, subarachnoid, subdural hematoma. The patient has drowsiness, vomiting, and seizure on examination. The patient has papilledema on fundoscopy. Coming towards chronic paroxysmal hemicrania, it is actually the excruciating pain, and pain is in hand which radiates towards eye, neck, shoulder. It differs from cluster headache because it is usually in females, while cluster headache is commonly in males. And it is in short paroxysms like 20 to 30 minutes, and it is more frequent, like 14 episodes per day can be there in chronic paroxysmal hemicrania. And it is also associated with nasal stuffiness, rhinorrhea, lacrimation like cluster headache, and it has a very good response to indomethacin. Then we have trigeminal neuralgia. Trigeminal neuralgia is the excruciating paroxysms of pain which last for seconds to minutes. It is usually on face. Then we have idiopathic intracranial hypertension. It is we have to suspect this when the patient is young obese woman. She has headache, blurring vision, obscuration, nausea, and on examination she has papilledema. Urgent referral is necessary in this patient, and there is no certain cause of idiopathic intracranial hypertension. So when we are going to refer the patient to a specialist, if the headache is of thunderclap character, and we have a suspicion of subarachnoid hemorrhage and hematoma, prolonged neurological symptoms, complicated migraine is there, this diagnosis is uncertain, and positive neurological focal signs are positive. These are some of the causes which on which we have to urgently refer the patient. Thank you.